Hello, my name is Hannah. I'm going to be your nurse today, performing the head-to-toe assessment. Okay, so I need to make sure I have all my supplies. I have my gloves, my hand sanitizer, my stethoscope, my pen light, and my alcohol swabs. I'm going to perform infection control and clean off my stethoscope. And hand hygiene. Alright, so do you use any assistive devices?
No.
Perfect. And if you have any pain during this assessment, just let me know. I'm going to ask you a few questions. Can you state your name?
Maddie.
And your location?
Old Orchard Beach.
And the day?
Sunday.
Alright. Patient is alert and oriented ×3. Level of consciousness is appropriate and is able to answer questions clearly. Now I'm going to state 3 words, and I want you to recite them right now, and I'm going to ask you later on at the end of the assessment if you could repeat them. So they are sun, dog, and tree.
Sun, dog, and tree.
Perfect. Now I'm going to assess your cranial nerves. Can I have you smile, frown, puff your cheeks out, and raise your eyebrows? Perfect. Patient's cranial nerves are intact and able to respond to command. And now I'm going to have you test your fine motor skills. If you can touch your fingers to your thumbs and back. Perfect. So the fine motor skills are intact. Now I'm going to have you close your eyes, and I'm going to touch a certain point on your body, and I want you to let me know where it is.
Left foot. Right knee. Left shoulder. Forehead.
Alright, so patient sensation is intact and is able to distinguish between upper and lower extremities and the face. So now I'm going to have you stand up. So I'm going to assess your gait. So you can walk to the end of the room here. And back. Perfect. So patient's gait is normal, no swaying, no limping, no abnormal balance or coordination. So now I'm going to have you stand on one foot. Perfect. Now the next. Alright, so patient's coordination and balance is intact. Now I'm going to assess your spine. If you could turn around and dive over. Perfect. Alright, so patient's spine is good. There's no curvature in the spine, no signs of scoliosis, kyphosis, lordosis, and no palpable masses or lesions, and posture is erect. So now I'm going to do range of motion in the upper extremities. If you could just put your arm in a circular motion. No crepitus, any pain. Alright, can you bend your elbow? No crepitus, any pain.
Nope.
And now your wrist in a circular motion. Alright, no crepitus, any pain.
No.
Repeat on the other side. And put your arm, same thing. No crepitus, any pain.
No.
Alright, and now on your elbow here, bend it. Okay, no crepitus, any pain. And then rotate your wrist. Alright, perfect. No crepitus, any pain.
No.
Okay, so now kind of put your hands out here. Alright, so the skin on the upper extremities are cool, dry, and warm to the touch. Your nails are intact, and there's no clubbing. The capillary refill is under 3 seconds, and there's no tuntings with a skin turgor, so no dehydration. And now I'm going to check your radial pulse. Perfect. There's no abnormal rates or rhythms. It's present bilaterally with +2 strength. And now I'm going to, can you put your arms out straight? And can you push against me? Perfect. And against again. So the strength is 5 out of 5 for the upper extremity. Now I'm going to assess your lower extremities. Range of motion. If you could kick your leg out straight. No crepitus, any pain?
No.
And kick your knee back. No crepitus, any pain?
No.
And repeat on the other side. Kick your leg out straight. No crepitus, any pain?
No.
And bend your knee back. No crepitus, any pain? No. Alright, perfect. So now I'm going to have you sit down. I'm going to assess your head and neck. So head is placed appropriately on body. Size and shape is appropriate. Skin up here is pink, flushed, and it's cool. It's warm and dry to the touch. Now I'm going to put my gloves on and assess your scalp. Alright, so upon palpation of the scalp, the hair is evenly distributed, of good texture and color. There's no critters or nits present. No masses or lesions either. feel it. So there's no goiters. Trachea is midline. I'm going to test your swallowing. Can you swallow? All right, patient swallowing is intact. Now I'm going to palpate your frontal and maxillary sinuses. If you feel any pressure, let me know. Nope. Perfect. I'm going to feel for your lymph nodes. All right, perfect. Any pain in that? No. Perfect. So frontal and maxillary sinuses, there's no pressure reported, no hardening of the lymph nodes, which could be a sign of infection. So now I'm going to have you test your accessory spinal nerve. Can you raise your shoulders up? Perfect, that's intact. Now I'm going to test your TMJ. Can you open your mouth? No crepitus, any pain with that?
No.
All right, perfect. So now I'm going to test the range of motion for your neck. Can you put your neck forward, then backward, then to the side, the other side? All right, chin, range of motion in neck is good. Patient reports no pain. Now I'm going to assess your ears. Right, no lesions or masses or nodules. I'm going to assess for drainage. Perfect, so no drainage with the ear, and the skin is also warm, dry to the touch. Now I'm going to perform the whisper test. If you could just repeat the word that I said.
Dog. Cat.
All right. Patient was able to pass the whisper test and recall the words without any difficulty. Now I'm going to assess your eyes. All right, so the sclera is white, no signs of jaundice. The eyebrow hair and the eyelash is appropriate. No edema of the eyelids, and the cornea is clear. The iris is blue and round. The pupil is 4 millimeters in diameter. Eyes are symmetrical and with size and shape. Now I'm going to check your conjunctiva here. All right, that's pink with no drainage. Now I'm going to do a couple eye tests. First one is the cranial, the cardinal views of gaze. Can you just follow the pen light here? Perfect. So nerves are intact. Now I'm going to test your peripheral vision. If you could just let me know when you can see my fingers. All right, perfect. Passing with the peripheral vision test. Now I'm going to test your pupils. I'm going to just shine a light in your eye. All right, so the pupils are equally rounded and reactive to light. Now I'm going to do one more test. The accommodation test, if you can just follow this pen light with your eyes. All right, perfect. So pupils were consensual and constrictive bilaterally and accommodated. So now I'm going to assess your nose. So it's appropriate size for your face, no visible abnormalities. Do you have any difficulty smelling?
No.
All right, so I'm going to have you cover up one side of your nose and take a deep breath in. Now the other side. All right, perfect. Any difficulty with that? Perfect. So patient reports no difficulty smelling. The nostrils were clear bilaterally, and now I'm going to look for drainage. Right, no drainage present and no signs of a deviated septum. I'm going to assess your mouth. So the lips are pink and moist, and the mouth is appropriate size to body. So now I'm going to have you open your mouth and say ah.
Ah.
Perfect. So the uvula is midline, tonsils are intact. Mucosal membrane is pink, hydrated, no signs of cyanosis. Can I see your teeth? Teeth are healthy and no signs of plaque. Can you stick your tongue out for me? Perfect. The tongue didn't deviate to the side and no odor is present. And the skin on the face is warm, dry, and pink to the touch. So now if you could lean back, I'm going to assess your pericardium. Perfect. No signs of heaving. There's no palpable flutters or difficulty with breathing. Now I'm going to assess your heart. there's no abnormal rate or rhythm, no whooshing sounds, and the S1 and S2 were intact and present, so my tricuspid valves are working good. Now I'm going to assess your carotid pulses. Alright, so pulses were equal in strength bilaterally. Now I'm going to auscultate them. Now with my bell. Alright, carotid pulses were +2 bilaterally in strength, no groots or whooshing sounds. So now I'm going to have you stand up so I can check your chest expansion. Turn around. Take a deep breath. Alright, perfect. So the patient was able to inspire without difficulty, no barreling of the chest, and the chest is cone-shaped. Now I'm going to have you sit down so I can assess your lung sounds. Alright, can you take a deep breath? And again. And again. And again. One more time. Great. Do that on the front. Deep breath. And again. And again. And again. Perfect. So lung sounds are present equally bilaterally. No signs of crackles present. No signs of bronchi or wheezing. So I'm going to ask you, do you remember those 3 words that I had you remember at the beginning of the assessment?
Sun, dog, and tree.
All right, patient's short-term memory is intact. I was able to recall the 3 words. So now I'm going to assess your abdomen. If you could lay down and with your knees bent here. I'm going to just lift your shirt. Is that okay? All right. Skin is intact. No visible masses or lesions. I'm going to listen in all 4 quadrants for lung sounds. Abdomen. Now for the aorta. Okay. So the bowel sounds were heard in all 4 quadrants, and there was no hypo or hyperactivity. And with the aorta, there's no signs of an aortic aneurysm. Now I'm going to listen for vascular sounds. Okay. Vascular sounds are present, no abnormal rates or rhythms. Now I'm going to palpate your abdomen, and if you let me know if there's any pain at all.
No pain.
All right, perfect. Patient reports no pain upon palpation. And skin, there's no masses, lesions, or anything present. So if you can turn around, I'm going to assess your range of motion in your lower extremity. If you can twist your ankles in a circular motion. No signs of crepitus, any pain?
No.
Right. And nails are intact, no signs of clubbing. Skin turgor is good, there is no tenting, so no dehydration. Capillary refill is under 3 seconds. I'm going to assess your pulses. Your dorsal pulse. Alright, good. Now your posterior tibialis. Perfect. Both pulses were +2 in strength and equally bilaterally. Skin is warm, dry to the touch, and pink to the touch. And now I'm going to do resistance. If you can just push up, put your legs straight, and push up against my arms. Perfect. And push down. All right. And do you have any questions.
Nope.